Hi, I'm Scott Quisling, and I'm a sports medicine specialist with Resurgens Orthopaedics, working in the Lawrenceville office. And I'm here to talk to you today about ACL tears. An ACL tear stands for an anterior cruciate ligament tear, which is an injury to the ligament in the middle of the knee. Most of the time, this is a sports medicine type of injury when an athlete is playing a sport. Typically, it's what we call a non-contact injury, which is where the athlete is running and they twist or cut, and that action causes an injury to the knee, typically an injury to that ligament. Certainly, this injury can happen in other settings, and we see it sometimes in work-related settings. Any situation where a person stumbles, falls, twists, they can injure the ACL. It's not just in sports, so it's any type of injury where the knee is stressed in an oblique or kind of a twisting type fashion. To diagnose an ACL tear, we use a clinical examination. A lot of times by the history, we can make a pretty good determination that there's been a major injury to the ligaments. However, the clinical exam is real helpful in figuring out if somebody has torn their ACL. More advanced imaging like an MRI is also very helpful in determining whether somebody has torn their ACL ligament. Plain radiographs don't always tell us, and so we sometimes rely on advanced imaging to make this determination. The surgery to repair an anterior cruciate ligament, really what we're doing is we're rebuilding the ligament. So we don't necessarily repair what the patient has. We do a reconstruction of the ligament, which is the standard of care. This is done arthroscopically. In the old days, it was done through a very large incision. Now we use small incisions to rebuild or basically reconstruct this ligament. So the recovery after an ACL tear is commonly discussed, and it's typically the type of recovery where the surgery is an outpatient surgery where the patient goes home that day. They're actually expected to be up and around pretty quickly on crutches. Gradually the crutches are discontinued, and therapy is a big part of the recovery process. So the patient is back mobilized pretty quickly, but it takes several months until the patient is ready for a return to full sports.